Hello, everyone. Welcome to the FIP digital event with the main thematic of antimicrobial resistance and stewardship education, supporting development of the pharmaceutical workforce in AMR and AMS. Next slide, please. I'm Katia Caneiras, and I am co-chair of the AMR Commission, FIP AMR Commission, and also professor of Egas School of Health and Science and University of Lisbon in Portugal. Next slide, please. First of all, I would like to share with you some announcements. As you know, this webinar is being recorded and is also live streamed via YouTube. The recording will be available on the FIP website. Moreover, you may ask questions using the question box provided, the Q&A box. So our speakers will answer to you, and at the end of the session, we'll have also time for some questions. You are always welcome to provide feedback to webinars at fip.org. And also remember that you can share the possibility to become a member of FIP on this website. As learning objectives of our session of this event, we expect that we can, at the end of the event, outline the educational needs of pharmaceutical students, practitioners, and also educators. We want to describe the good AMR and AMS educational programs. We'll talk about these educational programs, and we will also learn how to improve the current curriculum in terms of AMR and AMS education. Next slide, please. Our agenda will be the welcome by the share that is already done. Then now we'll go to the launch of the report. As you know, we'll have FIP educational report. Alison will talk about the introduction and methodology of the report, and then Rula will share with us the findings from this FIP educational survey. Then we'll have time for 3 case studies: Happy Patient Project, Advancing AMR and AMS Education Tanzania, and also the Students' Perspective by our IPS, the representative. Then we'll have the questions and answer session, and finally the wrap up and next steps. Next slide, please. Welcome to our speakers. It's a great honor for us to have this panel. So thank you very much, Rula, Alison, that will be by video, Martin, Amissi, and Suhaib. Then and I will present them all during our event. As you know, it is now the World AMR Awareness Week. So this is the first digital event on AMR and AMS education survey report. Then today we'll have also the launch of FIP report. And I invite you all to assist to the digital event on role of pharmacists in fungal disease management tomorrow. And in the day after, we also have the launch of the FIP Statement of Policy on Mitigation to Antimicrobial Resistance through Antimicrobial Stewardship that, as you know, has been approved in our last Congress, and it will be launched this week. Also, we'll have our AMR co-chair, Mrs. Manjiri Garat, speaking at the World Medical Association of WHO with the thematic Engaging Healthcare Professionals and Civil Society towards the AMR high-level meeting. So it will be a very important week with several events promoted by FIP. On the next slide, please. As I mentioned to you, tomorrow we'll have this event. So here you have the QR code. You can register easily. Only take a photo and access to this event. And tomorrow you will have the opportunity to learn more about the fungal disease management. Also, as you know, we have all events aligned with the FIP Sustainable Development Goals. So we are talking about antimicrobial stewardship, the 17 development FIP development goal. So we are talking about the workforce, the practice, and the science element. Globally, we'll have strategies and systems in place to development a pharmaceutical workforce prepared to deliver quality services for antimicrobial stewardship. On the practice element, we will have infrastructures and frameworks in place to deliver services for antimicrobial stewardship and also promote research and development of new antimicrobials, new antimicrobial combinations and new techniques, and evaluate the impact of antibiotic stewardship programs. Also, the FIP report that I mentioned to you that will be launched on 22nd of November. You will have the opportunity to see that report on 2 days, but now we'll have the opportunity to launch the FIP report about antimicrobial resistance and stewardship education. So you can scan this QR code and you already have the PDF report in order to read all the details about our report. But now we'll have also Alison and next the main conclusions about this FIP report. So now we'll start with Alison. Alison is a PhD student, Department of Pharmacy and Pharmaceutical Science Education at Monash University, Australia, and is also past FIP Educational Partnerships and Project Manager, and she will talk us by video about the introduction and methodology of the FIP report.
Hello.
Let's talk, Alison. Thank you.
Good afternoon, good evening, everyone. I'm Alison Ubometugopan, a PhD student from Monash University, and I'm really excited to present the introduction and methodology of this FIP report, Antimicrobial Resistance and Stewardship Education, supporting the pharmaceutical workforce development in AMR and AMS. So thank you for joining me, and I do apologize for not being able to join the event live today, but in the next slide, I will give a brief outline of what the presentation will be about. We'll do a bit of acknowledgement of those who have supported the development of this report, and of course, give a background to the report by delving into the factors and things that motivated us to develop this report, and of course, the process for which we employed to develop this report, as well as the objectives, the scope, and the distribution of responses. And I would like to begin by expressing our sincere gratitude to all those who have contributed to this report, to colleagues who have reviewed, who have edited, and of course, very importantly, to those who responded to the survey on which this report has been developed. And you can see the names on the slide there. I'm really thankful. Thank you for the collaboration. Thank you for the support. Thank you for the hard work. And now to give a background to this report, it's essential to recognize the magnitude of AMR the WHO has identified antimicrobial resistance as one of the top 10 threats to global health. And this does not just affect humans and animal health, but it also impacts the environment, the food and nutrition security, and all of that. Rightly situated in all of these is the accessibility of pharmacy and pharmacists to the public, and this position as the most accessible healthcare professional. Pharmacists play a crucial role in combating AMR and promoting antimicrobial stewardship. Our influence is far-reaching in education, in stewardship, in awareness, impacting not only the individual health, but the communities as well. However, despite this very important role that pharmacists play, there exists a gap in our understanding. There is limited evidence to demonstrate what the educational content and the educational needs of the pharmaceutical workforce are at the global level in AMR. Also, evidence from evidence suggests that a strong willingness among health workers and students to enhance their knowledge and competence in this area. So there is the desire for targeted, effective, and relevant education and training on AMR. And this underscores one of the reasons why this report has been developed. And in this slide, I will shine the light that as we align our efforts with global initiative, this report is purposely designed to address the FIP Development Goal 17 and the workforce element of this development goal. The workforce element of this development goal ambitions having a strategies and system in place to develop a pharmaceutical workforce prepared to deliver quality services for antimicrobial stewardship. And for this goal to be achieved, our report outlines specific mechanisms that will enable the workforce to acquire necessary knowledge and skills at various stages. So there is a focus on initial education, early career training, CPD, and additionally, building on this report where we've identified competencies needed for AMR and antimicrobial stewardship, there will be a need to incorporate these competencies into the competency framework and advanced and specialist development. So now in the next slide, I'll just give you a quick overview on how this report was developed. We have done a bit of preparation to create the survey, done pilot testing of the survey, we've distributed the survey, done an analysis, and of course now we are launching the report. So we followed a quantitative cross-sectional survey, which was conducted online using question proof platform. And this questionnaire was designed and piloted in 2022, and it consisted of 3 sets of questions, so targeting pharmacy educators, targeting pharmacy practitioners, and targeting students, all linked to the objective of the survey, which I'll be sharing shortly in the next slide. And the survey for pharmacy educators and pharmacy practitioners were developed based on the 5 modules of the WHO curriculum guide. And this questionnaire was distributed across August 2022 up till September 2022. In details of the survey can be found in the Appendix A of this report. And in 2022, we did a presentation of the preliminary findings of this survey. and did a descriptive analysis using Excel to just put all the data together. Um, to give more light on what the survey was about, the survey was developed to answer the question, what is the educational content for the pharmaceutical workforce on AMR? And for us to achieve this, we had 4 objectives. First of all, focused on the pharmacy educators, we wanted to investigate the educational component of AMR for the pharmacy workforce, and we based this on the WHO Health Workers Education and Training on AMR curriculum guide. And the second objective of this work was to evaluate the relevance of AMR educational component for pharmacy practice from the practitioner's perspective. So another bit of the survey and the report is focused on the responses from pharmacy practitioners. And then we had the focus on students, where we wanted to assess the students' perspective on their AMR educational components and finally, we collected like case studies on example of good practice on course description and all of that, innovations in AMR education. So all of this has been organized in the chapter 3 of the report. Each findings have been arranged based on this objective to really make it easily accessible for you to understand. And now to give you a bit of the scope of this survey, our findings were built on the 5 modules of the WHO framework. And this is crucial to understand this scope while reading the report. The foundation of our survey was on this WHO framework, and this guide outlines the 5 essential modules that are recommended for pharmacists, all of which align seamlessly with the domains of the WHO AMR competency framework. So for our survey, we checked about the foundations that build knowledge and awareness of AMR, and try to see whether the knowledge, the skills, and the attitude for this is being delivered in the curriculum from the educator's perspective and from practitioners if it is actually relevant to them. And of course, the next module we had was the appropriate use of antimicrobial agents. And this one addresses a very critical aspect of the use of medicines. Here, the survey explored educational content that equips students with the necessary knowledge and the skills and attitude to ensure responsible and effective use of medicines. And of course, we can't remove the infection prevention and control part. This is another module in this framework. And our survey investigated, these elements as well, are the knowledge, the skills, and the attitude being delivered properly to pharmacists to achieve this. And we also have the diagnostic stewardship and surveillance module, as well as the ethics and leadership governance module. And just a bit of wrap up, I would show you the distribution of responses. So we gathered 272 responses of the survey from across the globe. And you can see here the responses of educators, of students, and of practitioners. And you also see the sample respondents from each of these WHO regions. and there are countries, the number of countries that responded from this. So regarding regional distribution, you would see that Africa has the highest number of sampled respondents amongst educators and as well as practitioners. And Europe has the highest number of sampled respondents amongst students. And this is just to give you an overview of what the report looks like. And I know that the couple of presentations after mine will show you in-depth and example content from this report and how you can use this report in your context. And thank you so much for listening. Hello, good morning.
Thank you very much. Alison is not with us, but thank you for the amazing work that Alison and all the old FIP members team has made. And now we will talk about the main findings from this FIP educational survey on AMR and AMS with Professor Rula Darwish, that is Dean of the School of Pharmacy, the University of Jordan. Professor Rula, please.
Thank you, Katia.
Yours.
Hello, everyone. And thank you, FIP, for giving me this opportunity. I'll be talking about the findings from the FIP survey. The major objectives were to identify knowledge, skills, and attitude for antimicrobial awareness, for appropriate use of antimicrobial agents, for infection prevention and control, for diagnostic stewardship and surveillance, as well as for ethics, leadership, communication, and governance, from pharmacy educator point of view and from practitioners' point of view. Next slide, please. This table here shows the characteristic of the pharmacy educators. We're going to start now with the pharmacy educators and then later the practitioners. As you can see, more than half of the participants were working in the field of clinical pharmacy and pharmacy practice. More than half of them had PhD degree, and unfortunately, not all the regions responded, but more than a quarter of the educators were from Europe. Next slide, please. Thank you. So for the first objective, if we look at the extent to which pharmacy educators think their curriculum imparts knowledge on awareness of antimicrobial control strategies, we find that the educators think that the microbial causes of common infections were covered, also as well as the process involved in infection, diagnostic, transmission, prevention, and control of common infections. The same thing for choice of antimicrobial therapy based on comorbidities and current evidence, as well as classification of antimicrobials, details of pharmacodynamics and pharmacokinetics, concept of broad and narrow spectrum antibiotics, as well as concepts of empirical and cultural based treatment strategies. However, as you can see, there is room for improvement. These insights can help identify areas for further curriculum development to enhance student awareness and understanding of antimicrobial control strategies. Next slide, please. Also, if we look at the skills now for foundation that build knowledge and awareness of AMR, you can see also the respondents, the pharmacy educators find that advice on appropriate antimicrobial drugs based on the source of infection is covered. Application of laboratory and imaging test results in pharmaceutical care as well. Also developing and implementing pharmaceutical care plans and modifying plans for a patient with specific conditions. All these suggest that pharmacy educators perceive their curriculum to be effective in equipping students with the skills to improve awareness of antimicrobial resistance. And these insights indicate that the curriculum adequately addresses the skills required to combat antimicrobial resistance and prepare future pharmacists for their role in managing infection and antimicrobial therapy. However, there are again some areas for improvement, as you can see from the percentages. Next slide, please. As for the attitude, the pharmaceutical educators think that their curriculum has strong emphasis on patient-centered care in infection management and in working in antimicrobial stewardship or care team. However, they indicated that record keeping and documentation of antimicrobial use history is lacking, as well as performing or contributing to clinical audits and participation in quality improvement programs relating to rational antimicrobial use. So again, here we can find that although it effectively, the curriculum effectively promotes attitude that improve awareness of antimicrobial resistance, but there are still areas for improvement. Next slide, please. So if we look at this objective, we can see that pharmacy educators generally believe that their curriculum effectively imparts knowledge on antimicrobial resistance control strategies, and also they think that curriculum promotes attitude emphasizing on patient-central care. However, there are areas such as, for example, the relevance of pharmacogenomics and record-keeping attitudes may require further emphasis. And these findings can inform curriculum developers to enhance students' awareness, skills, and attitude in combating antimicrobial effectively. Next slide, please. So if we look at the second objective, that is related to knowledge of appropriate use of antimicrobial agents. Here we have the pharmacy educator pointed that there is lack in knowledge on the safe use of antimicrobials, drug allergies, common signs and symptoms of antimicrobial toxicity. Also, there is lack of the importance of reauthorization of certain antimicrobials and the role of pharmacists in achieving this safely without risk to patients, as well as understanding the WHO strategies to optimize antimicrobial agents. So we can say that, again, the findings indicate that not many pharmacy educators believe their curriculum impart knowledge for the topics related to the appropriate use of antimicrobials, and thus there are areas where improvement is needed. Next slide, please. As for the skills for appropriate use of antimicrobial agents, again, the findings indicate that educators believe their curriculum equips students with the ability to counsel patients on the proper use of antimicrobials and to critically assess all prescriptions for accuracy, safety, and adherence to local policies, as well as to give clear advice on dosage administration, dose intervals, storage, side effects, interactions. However, still there is gaps. The curriculum lacks the proper skills to equip students for appropriate antimicrobial use, including ability to create a system to investigate and record and report adverse events and substandards and falsified antimicrobials to relevant authorities. Next slide, please. As for the attitude, again, the findings indicated that there is a willingness to communicate in multidisciplinary team. However, there is a low extent of willingness to perform or contribute to clinical audits and quality improvement programs, and their lack of enthusiasm approach to the culture of quality improvement. And this also highlights the need for educators to emphasize the importance of these activities and provide opportunity for students to engage in such initiatives. And according to the results, information about audits it seems always to be low and shows the potential gap in the overall team. Next slide, please. So if we look at this objective, it is evident that while pharmacy educators perceive a generally high level of knowledge, which is imparted about the appropriate use of antimicrobials. There are still areas for improvement, like, for example, pre-authorization and review of prescription. Also, although the curriculum effectively equips students with counseling skills, but still there is needs to enhance in skills for investigating adverse events and developing antimicrobial resistant management plan. Also, the educator recognized the importance of communication and continuous improvement, but however, they should foster enthusiasm for quality improvement programs and emphasis on prescription scrutiny and promoting antimicrobial stewardship principle. These insights guide curriculum improvement to enhance students' knowledge, skills, and attitude for combating antimicrobial resistance effectively. Next slide, please. Now, for the next objective, this is related to infection prevention and control. So if we look at the knowledge part, we find that the findings indicate that pharmacy educators believe the curriculum was observed in understanding the need to educate patients on how to use antimicrobial provided at the time of discharge. However, there is some gaps, let's say, a low extent of knowledge in the context of understanding the value of monitoring and identifying contamination and developing a surveillance system and route of contamination and how to prevent this contamination. And also, importantly, understanding contamination that might occur during manufacturing or when healthcare providers improperly prepare or handle or dispense the drugs, the antimicrobial agent. Next slide, please. As for the skills for infection prevention and control, again, the findings indicate that pharmacy educators believe their curriculum covers the skills to demonstrate vaccine knowledge, awareness, and the role of vaccine as public health measure to prevent infection. However, again, there is room for improvement in the curriculum in that we can improve how to demonstrate the ability to refer suspected or proven cases of antimicrobial contamination to the appropriate authorities. Next slide, please. So if we look at this objective, the curriculum is effective in imparting knowledge on educating patients about antimicrobial use and healthcare-associated infection. However, there is need for improvement in understanding contamination risk during manufacturing and the importance of monitoring and surveillance system. Also, the curriculum, although it equips students with skills related to vaccine knowledge, but again, there is a room for improvement and the need to enhance skills in referring cases of antimicrobial contamination and monitoring good practice in pharmacy. And also, we can find that while hand hygiene practice are emphasized on, attitude related to self-declaration and abstaining from medication preparation when experiencing certain health condition requires further emphasis. Next, please. As for the diagnostic stewardship and surveillance, the knowledge part, you can see that there is room for improvement from the point of view of pharmacy educators in all aspects of the knowledge regarding how to collect and analyze antimicrobial consumption data and antimicrobial cost and expenditure. Also, the role of molecular, genetic, genomic test in antimicrobial resistant surveillance and the role of reference labs and observation. You can see the low points of preference in this issue. Also, the flow of data from receipt of specimen in a laboratory to performance of identification accessibility testing is lacking, and basic epidemiological indication, for example, incidence and prevalence data, point prevalence studies, use of appropriate denomination data. As you can see, the respondent responded in very low numbers. That means there is a good area for improvement in this regard. Next slide, please. Now for skills, for diagnostic stewardship and surveillance, again, there is room for improvement in all aspects of skills regarding the ability to collect and analyze antimicrobial consumption data and in preparation of reports and presenting the data in contributing to local indicators that measure antimicrobial use and to perform simple analysis linking laboratories, clinical and antimicrobial usage data. You can see the very low numbers. So again, this is an area for improvement. Next slide, please. For attitude regarding the diagnostic stewardship and surveillance, again, there's a high percentage of pharmacy educators that perceive their curriculum to promote respect for patient confidentiality and data protection regulations, participation in quality improvement program and working in multidisciplinary team. Again, it had high marks, and being an educator of colleagues, patient and public for good antimicrobial prescribing was indicated as strong points. However, again, there is room for improvement in being committed to meticulous record keeping and documentation, and even the previous points can be overcome if we work on them in a better way. Next slide, please. As for the recommendation related to this objective, you can see that the curriculum needs improvement in several areas of diagnostic stewardship and surveillance, such as enhancing knowledge on topics like antimicrobial consumption data, genetics, genomic tests, strengthening skills related to data analysis and reporting. And we think by addressing these areas, pharmacy educators can equip students with a comprehensive understanding of diagnostic stewardship and surveillance. Next slide, please. Now for the ethics, leadership, communication, and governance part. For the knowledge part in this objective, the findings indicate that there is a relatively low perception of curriculum that conveys knowledge of the importance of reporting substandard and falsified products and adverse effect, and also in proper record keeping of antimicrobial resistance, inventories, and use of product code for traceability. And this is really a good starting point to improve this objective. Next slide, please. Okay, as for the skills in relation to this objective, the findings indicate that pharmacy educators believe their curriculum provide basic skills in patient safety. However, there is room for improvement in good record keeping and documentation, as well as participation in quality improvement programs. Next slide, please. For the attitude, again, here, the findings indicate that there is a relatively low perception that the curriculum promotes attitude towards every individual who has the capacity to lead by example and to be a role model for the student, colleagues, and peers. So again, this needs special attention. Next slide, please. So for this objective, there are areas of improvement in pharmacy curriculum with regard to enhancing knowledge on reporting substandard products, leadership and governance, and effective communication. Also, there is need to foster ethical decision-making and leadership to best equip pharmacy students for ethical practice, effective communication, and sound governance in the prevention and control of antimicrobial resistance. Next slide, please. Now, this was from the pharmacy educator point of view. If we look at now the practitioner's point of view, the study covered 123 pharmacy practitioners. You can see from the table here the demographic data, and you can see that we tried to cover different areas of practice. Next slide, please. So regarding the first objective, which is the knowledge, skills, and attitude of antimicrobial awareness, the practitioners acknowledged the significance of comprehending broad and narrow spectrum antimicrobials, also the essential properties of antimicrobial classes. However, there is recognition of the role of pharmacogenomics in antimicrobial therapy selection and resistance is lacking. There exists a notable gap in awareness among practitioners regarding drug-bug combination. Again, here, It is similar to the pharmacy educator point of view, if as you have noticed, and the survey underscored the necessity for honing skills to effectively manage intricate medical conditions within the context of antimicrobial resistance. Also, the practitioners expressed the value of imparting knowledge about antimicrobials and antimicrobial resistance to both students and colleagues. However, they think that the importance of integrating clinical audits and quality improvement initiatives for the purpose of rational antimicrobial utilization is limited. Next slide, please. As for appropriate use of antimicrobial agents, the practitioners express understanding the application of antimicrobial resistance on patient care and community health. However, there is limited appreciation for practical benefits of grasping the WHO strategies for optimizing antimicrobial use. Also, the importance of sharing susceptibility data for control, the MIC data, and time concentration aspects. It was found that lower level of awareness regarding these issues was found. Also, in addition to the value of the acquisition of skills that enable them to effectively guide patients on appropriate antimicrobial usage, also, the practitioners emphasize the necessity for precise guidance on dosage preparation and accurate dispensing of prescription for both outpatient and inpatient. There is also, it was found that there is a limited perception of the benefits of medication utilization review and management plans among pharmacy practitioners. Next slide, please. So pharmacy practitioners express willingness to educate patients about responsible antimicrobial use and discourage self-prescription and over-the-counter purchase. However, there is reduced enthusiasm for engaging in clinical audits and improvement initiatives. Next slide, please. As for the skills for antimicrobial awareness from practitioners' point of view, there is the ability, we find the ability to modify pharmaceutical care plan in patients with altered physiological status and extreme ages or complex comorbidities. We found this to have the lowest perceived usefulness. So this is an area where we should concentrate on when we talk about a plan. Next slide, please. So this highlights the potential area for improvement, as I just mentioned, especially for patients with complex medical conditions in the context of antimicrobial resistant awareness. Next slide, please. As for leadership, ethics, communication, and governance, the pharmacy practitioners acknowledged the lack of awareness of curriculum, emphasizing reporting substandard products and adverse events, as well as record keeping and traceability using product codes. They acknowledge the existence of basic patient safety skills from the curriculum. However, they identified the need for improvement in the record keeping and participation in quality improvement. They found the curriculum encouraged leading by example in peer group, and few of them believe the curriculum promote of being a role model for students and colleagues. So this is in agreement with the results that we obtained earlier from pharmacy educators. Next slide, please. As for infection prevention and control, again, the practitioners acknowledged the importance of patient education and on antimicrobial use during discharge and infection control practice. However, there exists notable gap in perceiving the value of comprehending risk associated with multiple dose vials and adhering to use by time date protocol in practice application. They demonstrate a commitment to upholding good pharmacy practice that includes, of course, proper labeling, storage of sterile products. However, the recognition of utility in referring cases of antimicrobial contamination remain relatively low. and this is again in agreement with the pharmacy educator point of view. They exhibited positive attitude towards maintaining meticulous hand hygiene. However, few appreciate the practical benefits of self-declaration and refraining from work under specific conditions to prevent the spread of infection. Next slide, please. From this, we can see that there has been similarities between the results of the practitioners and the pharmacy educators in many points. So what the way forward then? First, promoting knowledge, skills, and attitude for effective antimicrobial management. And this should be done by emphasizing on patient-centered care in infection management within pharmacy curriculum. In addition to cultivating a culture of working in antimicrobial stewardship or care team, and even extending this beyond the pharmacy to other healthcare providers' curricula. So we are talking about interprofessional interaction. Acknowledge the significance of record keeping and documentation of antimicrobial use. And this is with active participation in clinical audits and quality improvement programs related to rational antimicrobial use within pharmacy education. In addition to cultivating a culture of quality improvement and multidisciplinary teamwork among students, fostering collaboration in management of antimicrobial resistance. Next slide, please. Also, the second thing to do is ensuring the appropriate use of antimicrobial agents and strengthening. This is by strengthening the pharmacy education by updating curricula to include pre-authorization and prescription review, as well as skills for adverse events investigation and antimicrobial resistant management. Also prioritize teaching antimicrobial stewardship principles to students with a focus on prescription of scrutiny and understanding resistant mechanism. In addition to improving technical knowledge amongst pharmacy students, covering aspects like, for example, susceptibility data, pharmacodynamics, pharmacokinetics, and so on. Also, in addition to equipping students with skills to guide patients on proper antimicrobial usage, including dosages and preparation for both outpatient and inpatient. Next slide, please. The third thing is to expand on infection prevention and control. And this is by enhancement of knowledge regarding the broad principle of infection prevention and control within pharmacy education, with emphasizing on factors like WASH, comprehensive education on advanced topics, including collection and analysis of antimicrobial consumption data and the role of molecular genetic genomics tests in antimicrobial surveillance and the flow of data in laboratory testing processes. Next slide, please. The fourth thing is to strengthen diagnostic stewardship and surveillance. And this is done by elevation of students' skills in collecting and analyzing antimicrobial consumption data, creating reports, and contributing to local indicator measurements of antimicrobial use within the pharmacy education. Also, enhancement of skills related to performing analysis that establish connections between laboratory, clinical, and antimicrobial usage data. By this, we are promoting effective diagnostic stewardship and fostering attitude of unwavering commitment to meticulous record keeping and documentation. This is very important, of course, for antimicrobial resistance, to ensure precision and reliability of data association with antimicrobial resistance. Next slide, please. Now, for ethics, promotion of ethics, leadership, communication, and governance. And this is by amplification of students' attitude regarding ethics, leadership, and communication and governance within pharmacy education. Also encouraging students to serve as role models for their peers and future colleagues, and fostering a culture of mentorship and positive influences. In addition to promoting knowledge of environmental pollution, of antimicrobial agent and sustainability, very importantly, promotion of multidisciplinary approach and interprofessional education. This is very important in AMR education and training across various professions like medicine, pharmacy, nursing, veterinary medicine, and agriculture. And this collaboration approach will have a holistic understanding of AMR, biological, clinical, and societal dimensions. Next slide, please. Thank you very much for listening.
Thank you very much, Rula. It was great to listen to you with all these findings of FIP education report. We already have some questions. I also have some questions for you also, but we'll talk later in the event. Now we'll have Martin Lambert, that is our speaker, about optimizing antibiotic dispensing practice in the EUA, the Happy Patient Project, that is PhD candidate from University of Groningen, Netherlands. So Martin, please, the floor is yours.
Thank you very much. Thank you for having me, and thank you everyone for attending this very interesting session, and also thank you for the previous presentations, because it has been very interesting so far already. I'm gonna tell you something about a research project, a very practical research project in the community pharmacy setting in the European Union, in which we aim to improve antibiotic dispensing practice in different countries according to European AMR guidelines. And that's a report you see on the right-hand side. The proposals for EU guidelines on the prudent use of antimicrobials for humans. This is quite an extensive document, although the paragraph on pharmacy and pharmacists is only about half a page. But I guess this is something inherent to pharmacy practice, and always to see doctors and policymakers in front of us. But nevertheless, there's an important page on us as well. And in this project, we looked at France, Greece, Lithuania, Poland, and Spain. And these are countries spread out over the European Union, so north, south, east, and west. And they also have different patterns of antibiotic use. We used an audit and feedback methodology. And on the next slide, you'll see this is the APO methodology, or the Audit Project ODENS methodology, which is audit and feedback based on implementation of interventions. What you see here is a registration chart, and I'm not going through this in detail, but this is a self-registry chart which we provided to different pharmacies in the different countries I just mentioned. And what we asked them to do is to register what happens inside the pharmacy when a patient comes in with a prescription for an antibiotic. And we asked them to give us information on what antibiotic was dispensed, the location of the infection and the treatment duration, if this information was available, what kind of safety checks were performed during the dispensing process. Then we talk about drug-drug interactions or contraindications or checks for allergies. Then we also wanted to know what kind of advice was provided to patients in the pharmacy. So do you discuss treatment duration and dose, but also information on side effects, for example, and on giving information on the problem of antimicrobial resistance. And then finally, we wanted to know their professional judgment on the prescriptions and whether there was any prescriber contact. Then after the first registration, we implemented different interventions, and you see those on the next slide. So we did a communication training, and we trained pharmacists in communicating with patients, what to tell them, when to tell them, and how to tell them. There was a feedback meeting. So after the first registration period, we analyzed and summarized all the data, and then we provided pharmacists from all the countries with their individual results. So we showed them, all right, this is what you're doing in practice, this is what you've been registering. And then we put that next to the averages of every country. So a pharmacist from Spain would get individual results, and then also the results from Spain. And then it was not us, the researchers, telling them what we would have liked to see or how they could have been better. No, what we did is we put the pharmacists together and let them discuss among peers what's good, what could maybe improve, and how other pharmacists from their country were doing different things, and maybe how they could learn from each other. Also, we did an e-learning, which was an online website where pharmacists could get more background information on the problem of antimicrobial resistance, where they could find their individual results again, but also where we gave some background, some theoretical background on dispensing, what kind of advice do you give to patients for different antibiotic classes, for example, and there was also a knowledge quiz on this. And finally, on the next slide, you see some information tools. So what we did is we created these tools, which are posters or leaflets that we provided to pharmacists that they could use during the dispensing process. And it helps them to give the right information about antibiotics, antibiotic use to patients. So on the left-hand side, different kind of infections, which are likely caused by viruses or bacteria, and then why you use antimicrobials only for the bacterial infections and not for the virus infection, for example. And on the right-hand side, very practical leaflet you can give to patients on which it says when you have to take your antibiotics, what kind of food or drinks you can have with it, when you take it, when you stop taking it, what side effects are, etc. So on the next slide, you see that we conducted the research in 2022 and 2023. We had 91 pharmacies participating from the different countries, and the 91 participated in both the first and the second round. And you see that in February 2022, when we registered for 1 week, that we collected almost 2,600 dispenses of antibiotics to patients. And a year later, again, 1 week in February, we collected about 2,500. So on the next slide, I'm going to show you a few of the results. If you go one further, you see the first graph. It's a bit simplified, and there's only 4 to 5 countries just to keep it simple. But what you see here is an overview of the safety checks that were performed. And there's 4 bars from left to right. It's about interactions, contraindications, allergies, and none of the above, it says. So what it means, what we see here is audit 1 on the left-hand side and audit 2 on the right-hand side, and then for the 4 different countries. When we start at the left, we see that in France, the interactions, contraindications, and allergies are checked for relatively often. So between 65 to almost 80% of the cases. And what we see between audit 1 and audit 2, that the influence of the interventions has not been very large. There are some improvements definitely for the contraindications, for example, and also a bit for the interactions, but there are quite small improvements. But that's probably because the baseline of pharmacy care is already quite high in France. But when we look at the other countries, Lithuania, Poland, and Spain, we see some very important improvements in pharmacists checking for interactions, contraindications, and allergies. So ensuring the safety of treatment for their patients between audit 1 and audit 2. So improvements in interactions, contraindications, allergies. And we see them in Lithuania, Poland, and especially in Spain, very great improvements. And then on the right-hand side, so the black or dark blue bar, this says none of the above have been checked. And what we see in audit 1, this is a lot higher than in audit 2. So after training the pharmacist and letting them analyze their own practice, we see that they start performing more safety checks and therefore ensure the better safety of our patients. Then on the next slide, what we saw, so if we put all the countries together, so the 5 countries together rather than separately, we see that the safety checks they performed increased by 23%. The advice that was provided to patients was increased by 22%. And even more so, there was 54% reductions in the patients who received no advice at all. So what happened in the beginning of the project, we saw in quite a few cases that pharmacists did not give any information, any advice to patients, but this reduced quite a lot. Then finally, we also trained pharmacists in retrieving more information about prescriptions. So for what indication is a prescription prescribed, and what's the treatment duration of the prescription, because these are very important things to discuss with patients and also to ensure that the patient gets the right antibiotic. So on the next slide, it says these were all significant improvements, which is of course important. So the conclusions, the data suggests that the APO methodology is an effective way to improve community pharmacy practice, and that the multifaceted intervention that I showed you can improve antibiotic dispensing practices. And maybe most important is the next one, where it says that, if you go to the next slide, that pharmacists are very enthusiastic about being involved in tackling AMR. And I think this is important to stress here. We heard from quite a few pharmacists that it was the first time they were approached to be involved in research. And they said, well, it's always about the prescribers, about the doctors, but actually there's a large role for pharmacists. And they were really happy that they were involved, and they were really enthusiastic in improving their practice and help tackling the problem of AMR. Thank you.
Thank you very much, Martin, for the presentation of the results of Happy Patients project. And now we'll have Advancing AMR and AMS Education, Tanzania case study with Amizi, that is a master student, Pharmaceutical Society of Tanzania, Brighton, and Sussex Medical School, One Health Society Network for evaluation of One Health on Tanzania. The floor is yours, Amizi.
Yeah, thank you so much, Jasu. And I'm very happy to be one of the speakers in this FIP digital event. And it's already been interesting to hear from the Happy Patients project. So I will take through what I call like situational analysis on what is going on in Tanzania as far as AMR and AMS education is concerned, and to give a short of context in Tanzania. So we launched our first national action plan in 2017, just 2 years after the global national plan on antimicrobial resistance by WHO. And its implementation has been very good in terms of awareness and surveillance and research projects. So last year we ended our first national action plan, and we launched this year, early January this year, we launched our second national action plan from 2023 to 2028. And one thing that's remained to be very common between these two is our strategic plan objective, which is strengthening AMR education and awareness. So this gives the priority for the country, and specifically for the Ministry of Health, which has been the frontliner in implementation of defense projects on antimicrobial resistance. So as I said, I am also one of the team leads and member of One Health Society. So Tanzania, last year, November, we launched our One Health strategic plan. So in this strategic plan, it also complements the need for multidisciplinarity in addressing AMR, and in terms of education as well as researchers. Next slide, please. So I will talk a little bit about the structure of how the courses from the undergrads and postgrads to continuous professional development. And as of now, we don't have dedicated modules on antimicrobial resistance in both undergraduates and postgraduates. And as pharmacists and pharmacy students, we have been told the mechanism of how the resistance occurred, and in more as a topic during microbiology studies. And most of pharmaceutical postgraduate courses are not legally recognized in Tanzania. They are much more in development. So CPDs plays a vital role in covering this step on AMR education. So most of nation organized, like professional institutions like Pharmaceutical Society of Tanzania, and international institutions like the Commonwealth Pharmacy Association, the FIP, they also came in to fill the gaps in education. So we organized a number of CPD courses to make sure that pharmacists as well as other healthcare providers are receiving these educations and they're able to apply. We also have in-service training in hospitals and many other institutions, but mostly it is in hospitals. And this is mostly in private hospitals. Still in our government hospitals, they're catching up, but not that much. So in-service training is also part of AMR and stewardship education. And in much cases, we do university symposium and conferences also to kind of come together and make sure that we keep nurturing our skills on how to go around stewardship programs in hospitals as well as raising awareness. Next slide, please. So we had a couple, or we are having a couple of interventions and innovation in AMR education as far as Tanzania is concerned, and I will talk about these in innovations in two categories, and one is university and it's linked to the government and what they're doing, and other one is non-government organizations and what they're giving in to complement the efforts. So as far as university is concerned, there have been a lot of discussion around on curriculum reviews to make sure that we cover different aspects of antimicrobial resistance and what skills we're supposed to impart in students who are going to be the future healthcare workers, and also we recognize those who are already in the field. So there has been a 2 weeks short course on clinical pharmacy practice organized by University of Muhimbili and then Bugando in collaboration with CSSC, which is Christian Society, and also the Pharmaceutical Society of Tanzania. So those who are in practice as a clinical pharmacist, they are trained in 2 weeks on different aspects from pharmacovigilance on how to do a dose calculation, to follow up with antimicrobial stewardship programs, and to report ADR, adverse drug reactions. So this has been one of the initiatives in Tanzania. And also we're doing annual symposium, as I said. So the universities, different universities are organizing this kind of symposium to bring in the evidence and the researches and data from different areas of the country so that we can generate much of the data to be in the trends of our pattern of resistance and also what skills they needed. And more important is now we are looking at in One Health approach. We have been looking at in One Health approach, and now it's emphasized by that strategic plan that we have. So on NGOs, we have One Health Society. As I said, this one is specifically capacitating university students and the general community on AMR educations and mostly focused on One Health approach. So it has members from agricultural sector, it has veterinary expertise, it has an lab scientists, medical doctors, and pharmacists. So they are all making a holistic team that's going to give the package to the university students on how they can have that those skills to navigate the AMR. Antimicrobial resistance, which is also an NGO. This is primarily going to the primary and secondary school students, and it uses arts and some kind of music and drawing to make sure this education is passing down to the generation. And also with Aftertune. Aftertune, it creates animations and cartoons to make easy facilitation of messages from the expertise point of view to the community point of view. So this is kind of innovations and interventions that we've been doing and have been part of One Health Society, leading it to make sure that we see it in different lenses. Next slide, please. So the outcome of these initiatives and interventions has been to increase stakeholders' engagement because we're implementing the first National Action Plan. It was more settled in Ministry of Health, but now we have on board Ministry of Livestock and Fishery. And last 2 days we had our National AMR Symposium, where the Ministry of Health and the Ministry of Livestock and Fishery were kept together to discuss on how we can navigate this threat. And also, according to the innovations and interventions, we've been able to establish AMR clubs in schools and universities. So this is starting point to now complement what is lacking in the curriculums. So training these expertise in different levels, from the classroom to the clubs, and making sure that they know how to work together from different disciplines, and also to encourage students to now conduct their researches in antimicrobial resistance. So most of undergraduates and postgraduate students are now encouraged to do their theses and dissertation on antimicrobial resistance, so that we can generate a lot of data and to use them. And lesson that we have learned in this analysis and number of activities that we've done is, like, most of the personnel, especially pharmacists, are very ready to learn, and they are very cooperative when it comes to education programs. So this is one of the good signs in Tanzania, and I hope it is in many parts of the countries. And also demand for stewardship education in hospitals, because we have been facing a lot of cases in Tanzania, mostly in primary level, and I think the demand is high, and we are working towards channeling this education to the down, because almost 70% of Tanzanians are treated in primary and secondary healthcare facilities. So when we are going to tap in there, we're going to affect a lot of lives. And also, we have learned a very good point, which I want to highlight, is the role of technology and arts in antimicrobial resistance, because we've been using a lot of technologies to make sure that we reach a large number of population in our community. For example, as One Health Society, we use a push SMS kind of technology. So automatic messages are sent to the mobile phones of people in Tanzania who are subscribing to our system. So to kind of remind them every week on how to take care on infection prevention and control, and also how to interact with the environment and animals. And also the arts parts, we are doing cartoons and animations to make easy translation of materials. And also the need for clinical pharmacy services in hospital. So this is what we have learned so far. Next slide, please. So there have been a couple of challenges, and few of them is education materials that are relevant to our context. We have faced a lot of some of the materials that we used are not really channeled to our context. So sometimes we face different cases that are not much aligned with the material that we have. But we've been generating this as part of our projects to make sure that we cover different contexts of our country, because it's more spread out, and different areas are facing different kind of challenges as far as AMR is concerned, and different levels of education are needed. Also, a little understanding on education ministry, because in Tanzania we have Ministry of Health and Education Ministry, and most of high universities are under the Ministry of Education. So to change the curriculum, it needs the involvement of Ministry of Education, not only the Ministry of Health. So taking it in One Health approach, meaning that we need now to do high-level advocacy to Ministry of Education, so that they can understand the need for changing curriculum. So it has been a little bit of Ministry of Health thing. So we need now to make sure that all other sectors are knowing that this thing we can do it together. So also the capacity to act on the received knowledge. A lot of pharmacists and healthcare workers have been reporting that the capacity on the laboratories, the tests, diagnostics, availability. So they have knowledge, we are giving them and the knowledge, but the facilities are not supporting them to practice what they have now. So that's also a challenge. And also recognizing of these CPDs, as I said, they're playing a vital role. So if they are not recognized by our institutions, so it gives that hardship for personnel to pursue them. Next slide, please. So recommendation from these observation that we've been made is we need sustainable partnership with professional association and universities into making AMR and stewardship education programs. So this strong partnership will ensure sustainability of these programs to run in different universities, in hospitals, as well as in the community. And also we need curriculum review to include AMR and stewardship modules with very good point is relevance and multidisciplinary nature, because now we are talking about AMR, and as pharmacists we need to have the skills and capacity to work with other disciplines, and also to recognize these CPDs as one of important areas, and also to, I think, to generate from international institutions like FIP and Commonwealth Pharmacy Association to be more channeled to personnel, and also to support existing initiatives. So as I say, in Tanzania, we have these very wonderful youth initiatives, like from cartoons to system messaging to arts. So if we support this to be sustainable, so we are building the generations that are already informed about AMR and what it is and how to tackle it. So these are the recommendations. I think that's my last slide. Thank you so much.
Thank you very much, Amisi, for your presentation. We'll have the questions later. And now we'll have the final speaker with the students' perspective, findings from FIP Educational Survey on AMR. Mr. Sohaib, I think that I said well, I'm sorry if I don't, from the International Relations Chairperson of APSF, and is talking by Algeria. The floor is yours. Sohaib.
Thank you. Can you confirm that you can hear my voice clearly?
Yes, thank you. We can hear you.
Thank you. And you indeed pronounced my name correctly. So I'm Sohaib Garat from Algeria, and I'm the current IPSF Internal Relations Chairperson. And today I'll be, let's say, accompanying you through this short, quick presentation that will handle the following aspects of the agenda. So we'll start with the introduction, pharmacy students' perspective about AMR and AMS educational strategies, AMR educational components for pharmacy practice from students' perspective and needs, and finally conclusion. So next slide, please. So for the introduction, it is to be known that IPSF has actively advocated for AMR and highlighted the role of pharmacists. Some achievements include co-hosting the Global AMR Youth Summit, publishing the AMR Advocacy Toolkit, and participating in WHO AMR consultations on a yearly basis. On the 21st of March 2023, the IPSF Pharmacy Education Committee joined forces with the University of Manchester, UK, to organize a highly informative and engaging webinar focused on the One Health approach to AMR. In line with this initiative, IPSF also launched the AMR article competition, providing an opportunity for students to actively contribute to this discussion on AMR. If you can pass on the next slide. Thank you. Regarding what students want to or should learn on AMR and AMS education, pharmacy students are inclined to acquire knowledge on both programs. Numerous surveys have been conducted to investigate the pharmacy students' knowledge, attitudes, and perception regarding this topic. Another research study conducted by IPSF with students and recent graduates highlighted the imperative to establish an enhanced curriculum that will effectively equip upcoming pharmacists with the necessary knowledge and skills regarding AMS interventions. Some pharmacy programs have also introduced specific courses or paths of distinction focused on AMS, while others have identified the need for more education on these topics. A clear example is highlighted in the School of Pharmacy at the University of Wisconsin, USA. The school has launched a PharmD path of distinction that is aimed at advancing the concept of AMS. Overall, we see that there is a need for more education and training on AMR and AMS programs in pharmacy curricula worldwide. Next slide. So now we'll be passing on to the pharmacy students' perspective about AMR and AMS educational strategies. This slide will resume this little title. So the creation of antimicrobial usage policies, training on antimicrobial therapy, and the creation of institutional antimicrobial user guidelines are seen to be the three most significant AMR interventions. Pharmacy students agreed that hospital and clinical pharmacists should be included in this EMS team. Being the most approachable professionals in the community, pharmacists can impactfully change the behavior of doctors, nurses, and customers when receiving proper education and training. The education can start from early years, like undergraduate degree, and followed by continuous professional development program of AMR and AMS. Rather than undergraduates, the stewardship program targets pharmacists with postgraduate degrees. There is a room for improvement to develop the undergraduate education specifically and training focused on AMS. Pharmacists are a key role in changing community perception of the demand in antibiotics, increase awareness about AMR, and hence provide a rational antimicrobial use, which will basically be the topic that we will be covering later on. So please keep this little phrase in mind. Next slide. So this little table showcases the pool of participants that have participated in this survey. So we see that we have a total number of 106 pharmacy students divided between 3 academic degrees, being B Pharm, PharmD, and M Pharm, while being distributed into 6 different regions: Africa, America, Europe, Eastern Mediterranean, Southeast Asia, and Western Pacific. So this will be the main pool that will be, let's say, we will be reviewing in this next slide, and they will each give their opinions and highlight the current status of the questions that were asked in the survey. So now for the first little part, the first subtitle in the major title, which is the AMR educational components for pharmacy practice from students' perspective, we can see that these two graphs show that most pharmacy students, 91 out of 106 respondents, have studied antimicrobials and AMR as part of their undergraduate degree. This suggests a strong inclusion of AMR education in their core curriculum. However, when seeing the part that concerns the additional courses outside of their undergraduate program, a smaller portion of students, 26 out of 106, have taken such courses related to antimicrobials and AMR. Overall, the findings highlight a positive trend in integrating AMR education into pharmacy undergraduate program, but there might be room to encourage more students to seek additional courses to deepen their understanding of antimicrobials and AMR. Next slide, please. So this one shows that overall, the data highlights a relatively strong emphasis on general pharmaceutical skills applied to infected individuals and the appropriate use of agents, and not, let's say, more specific approaches. However, there seems to be room for improvement in areas such as AMS, infection prevention and control, as well as diagnostic stewardship and surveillance, showcasing that we still need to include these various sectors and subfields into the AMR, AMS educational programs. Next slide. The first graph shows that the majority of respondents reported that AMR education is integrated solely into other courses rather than being an independent course or module, depending on the curricula. This suggests that AMR concepts are likely being incorporated into broader pharmacy-related subject, which means that we can say that AMR has been taught, or let's say widespread, as a subfield or as a continuation of already existing topics rather than being standalone. Additionally, 19 students mentioned that they receive AMR education through dedicated standalone courses. So this is like the minority of our survey. The next graph shows that most students, sorry, can you just go back? Thank you. The next graph shows that most students reported receiving education on AMR either through an entire module or course within the curriculum. or through more lectures spread over an academic year as part of other courses. A smaller number of students, being 6, mentioned other forms of AMR education that were not specified. Overall, we can say that it is evident that a substantial proportion of pharmacy students have been exposed to concepts related to AMR during their education. Next slide. The next graph shows that a relatively significant number of students view their AMR education as reasonable, approximately 53%, which is a little bit over half of the pool that was studied. There is a spectrum of opinions ranging from positive to those with limited exposure. The feedback underscores the importance of continually evaluating and enhancing AMR education in pharmacy curricula to ensure comprehensive understanding and preparedness among students. The following slide showcases that most pharmacy students feel confident about their skills for antimicrobial skill-related services after graduation. Specifically, 42 expressed being confident, 17 were slightly confident, and 7 were, let's say, very confident. This suggests that a significant portion of pharmacy students perceive themselves to be well prepared to address AMR challenges in their future careers, with only a minority expressing lower levels of confidence, which highlights the fact that we do have, let's say, work-ready pharmacists to tackle the AMR and AMS subjects. Next slide. So now for the overall perspective and needs that were highlighted from the answers that were given in this survey, we can say that firstly, there is a huge lack of depth and exploration. Some students felt that their educational AMR was inadequate, while others expressed a desire for more comprehensive lectures focused on AMR as it was expressed, indicating a need for more in-depth coverage of the topic in the curriculum. Students acknowledged the ongoing nature of learning about AMR and expressed optimism rather than pessimism or realism about gaining confidence in discussing the subject in their education progress. The second main need is, of course, the evaluation of course content and approach. Students mentioned that the focus of lectures often revolve around classifying antimicrobials, while aspects like prevention and control were relatively neglected. A suggestion was made for international institutions like FIP to increase awareness regarding AMR and emphasize its importance. The importance of proper antibiotic usage based on guidelines and sensitivity tests were highlighted. Next slide, please. The third, let's say, basic need was the curriculum enhancement, since it was expressed that let's say, a more dedicated approach or module or even a standalone course on AMR within pharmacy and pharmaceutical sciences education needs to be applied as soon as possible. The idea of incorporating AMR education into the curriculum was supported, with some suggesting more time allocation to increase awareness and knowledge delivery. The fourth need basically highlights the real-world impact and advocacy. Students recognize the need for advocacy in their communities to combat AMR, and basically the collaboration with organizations like WHO, FIP to involve youth volunteers in educating communities about AMR was proposed numerous times. Next slide. The fifth need would be the awareness and control. Students acknowledge the emergence of AMR as a global issue more during the past years, and the need for new antibiotics due to increasing resistance. Raising awareness and controlling over-the-counter antibiotics use were identified as important measures. Integrations and impact. Basically, some students learn about AMR through various subjects like microbiology, physiology, and pharmacology. So the impact of AMR education was highlighted in terms of informing students about the increasing resistance of old antibiotics, rather than being a standalone prospect or module that can be more developed thoroughly. Next slide. The last perspective and needs are highlighted in the societal awareness and action. So dissemination of AMR information to the public and increasing awareness to reduce its effects were seen as important steps. Collaborative efforts between the WHO and students who are suggested to educate communities and address AMR-related issues. The last need and perspective is highlighted by the professional and prescriber education that basically need to be made regarding AMR, indicating the importance of involving HCPs beyond pharmacy students. So most likely integrating already graduated students, healthcare professionals in this, let's say, specialized AMR course. Next slide. On to the conclusion, we can say that pharmacy students express a desire for more comprehensive and in-depth education on AMR. They recognize the need for advocacy, awareness campaigns, and collaboration with organized organizations to address the growing issue of AMR. Recommendations include enhancing curriculum content, involving various healthcare disciplines, and disseminating knowledge to the broader community. And I think this is the last slide. Can you forward it? Okay, so this was indeed the last slide. Hope it was an informative little session. I tried to make it short, concise, and precise, and I remain available for you in the Q&A session for any questions if needed. Thank you.
Thank you very much, Rahib, for your great talk. So we have now 1 minute to answer to some questions. So I will start by Rula. It's important, the curriculum content. All of you spoke about the curriculum content and the need of specific courses or specific curriculum units. So we have here one question of Ola. Does the curriculum specify didactic lectures and hands-on practical trainings on AMR and AMS? This will enable students meritary with practice. What is your thought? So do you believe that is needed undergraduated, postgraduated, both? What's your thoughts about it?
Thank you, Katia. I think both of them are very important. As you said, didactic courses are important so that we can make the base. But then again, it's very important to make like practical sessions and hands-on practice, and especially for antimicrobial resistance. There are many things to be done in the curriculum, to be honest, Katia. Because that's why we made the survey, so as to know where the gaps are. Interprofessional interaction is very important as well. So I think we need a whole session to talk about this. But what I mean, we have to strengthen not only the knowledge which is given usually by didactic courses, but also the skills and even the attitude. So not only giving the practice part, but also taking the students to the practical with the real patients in order to understand with the real team, so as to know exactly what type of antibiotic to be given, what time, the dosage, and route of administration, many things which is related to this issue. I hope I answered your question, Katia, very quickly, though.
Yes. Thank you very much, Rula. And Martin, Amici and Sohib have spoke about the need of education materials, the relevance of have also data about it. So from your Happy Patient study, I have two questions. One is, how did you selected the European countries to participate, and if it is a study open to another countries, European or not? And also, how can we get the materials, if it's open, or how can we share more about the project with all the participants?
Yes, thank you. That's an excellent question. And well, the project is actually ending next month. So it was a 3-year project and it's almost ending, and we're very busy with disseminating all the results. To start with your first question, how did we select the different countries? So as I said, the 5 countries we have are spread over the European Union. So we have North, East, West, and South. And there's different patterns in antibiotic use as well, because we wanted to see whether the effects of the intervention were different in the different countries. And we did see this a little bit. And by choosing these different countries with different antibiotic patterns and from different parts of Europe, we also try to make sure that our results are maybe translatable also to other settings. And this is also something that we really elaborate on in the dissemination of the project, that we really want to see that the interventions we did and the materials we made, that they can also be used in different settings inside, but also outside Europe. all the materials that we made, for example, the posters and the leaflets that I showed you, they will be made open access. We based them on a Delphi study, so a study in which we involved healthcare practitioners, pharmacists from different countries, and they were very closely involved in development of this. And this has also been published already, so these materials are already available open access.
Thank you. Thank you so much. We hope for this open access also soon. So, Anisi, do you want to share with us what are your thoughts about the AMR or AMS to outpatients? How for the communities? How can we involve the communities on this thematic?
Thank you so much, Kesia. So, and what I can say about the community and the outpatients is they're the very important player in this, because we need, first of all, we need that continuity of care, because when they're in the hospital, we can take care of, like we can be with them, we can give some instruction, but when they go home, they're by their own. So we need to make sure that we have that continuity of care. But if we have IPC practice in hospital, we need also to tell our outpatients on how important to do infection prevention control when they're at homes. So it will be very difficult if we are only securing our hospital settings and left them to practice what they want to practice at home. So it will be the same. We won't be solving, I think, the problem. So first of all is to make sure we have a continuity of care of anything we are doing in hospital, to make sure that we impact that knowledge for the outpatients. And also, taking from the experience from Tanzania, most of the outpatients, they are actually going to the community pharmacy directly. And this has been a case, and recently, the Ministry of Health has announced like a legal punishment for pharmacists who will give medicine without prescription. So it was yesterday, actually. So I think it's a very good point as well. So if community pharmacy is the primary point of care for most of people, and I think in most countries, so we need to empower the pharmacists as well, to make sure they direct these people to have the diagnosis, the right diagnosis, and come back to get the right medicines. So I think in outpatients, the community pharmacy are very important, and we need to have that continuity of care between hospital and the community.
Thank you very much for your comment, Hamisi. And Suhaib, I really believe the empowerment that students can bring to the thematics, to the force, including for the practitioners, because there's a lot of practitioners that attend to students' courses on the universities also. And drives the professionals to conduct the students to new perspectives. So we talk about, Rula has presented to us that there's a lack of there's a room for improvement on pharmacogenomics. In antimicrobial therapy, not only on resistance, but also in therapy. Also, there's a lack of knowledge also on data about resistance, susceptibility, the risks to the environment and to sustainability. How can the students drive this knowledge from your perspective? The generation of data.
So just to confirm, how students use this knowledge, or how can they disseminate the knowledge, or which parts?
How can they demand for universities to have this knowledge and then disseminate the knowledge?
Okay. So I'm going to give like a broader example. Usually in universities, there are two types of ways for students to advocate for these types of changes. So either by working as an in a sort of an association or clubs, because usually associations and clubs working within universities have certain relationships with the administration where they can have some leeway for them to advocate for students' rights. And this varies from country to country, university to university. The second part, the second way would be to, let's say, band together as students to write a formal paper and to, let's say, gather signatures from the concerned student, that means undergraduates or maybe even graduates, and provide the university, the dean of the university, or any responsible that is, let's say any administrator that is responsible for these matters, and to communicate with him as a unit. So give him a formal letter that says that the undersigned students, while giving the signatures and contact details of the concerned students, have agreed that as pharmacy students we need to have courses on AMR, AMS, etc., etc. So it's a two-type way: either work within the umbrella of an association or a federation, depending on the country, or work as a unit and advocate for it as students independently of any other organization. How can they disseminate the knowledge that they can gain? Well, they can, again, do it alone as a standalone pharmacist. Like they can, as we all know, we are in the realm of social media. Anybody, anywhere, anytime, any place can post on social media, can advocate for certain causes. So they can do it as individuals, they can do it in their own account, they can do it as pharmacists, or they can work within associations, within federations like FIP, like what we did today with this digital event where we talked about the current matter. So it's the same principle: either do it alone via social media, or work within associations, federations, global organizations, or even local ones to disseminate this knowledge. And we can also, I can also, let's say, advise it to be also within, what's the word, within the faculty realm, in the sense that doing it online is good, but doing it in real life on a grassroots level is even better.
Locally, right?
Doing it locally is even better, because the students can actually feel the impact of this knowledge. They feel the impact of this particular matter in his own life. If you can present it to him face to face, if you can give him real life advice, if you can give him real life events to relate to. So I think that will be my answer.
Thank you very much for your comments. We have to finish this webinar now, so I would like to ask to... So we already made a wrap-up about this. There is a lot of challenge. I think that pharmacogenomics, optimization of treatments, also the involvement of community and generation, the generation and the interpretation of data are some of the main challenge that we have. FIP is also contributing to this to this knowledge, and as I said to you, tomorrow we'll have another webinar about AMR and AMS, so you are all invited to assist. And finally, the next slide, please. Don't forget to pick up your agenda and to put there already 1 to 4th of September, Cape Town, South Africa. It will be the next FIP World Congress of Pharmacy and Pharmaceutical Science. So we hope to see you all there. Thank you very much for attending. Thank you very much for your time. It was a great session. Thank you for your questions. And we hope to see you on the next FIP digital events. Thank you so much. Have a great day.